How long does it take to have full comprehensive orthodontal treatment to straighten your teeth? What are the new trends in orthodontics? What do we do during consultations? Those are common questions I hear from my patients. In this video, I'm gonna cover all these questions, so you don't need to bother searching online or bothering your doctor asking questions over and over and over again. I'm Dr. Olga Dolghier, Palm Valley Pediatric Dentistry. I'm board-certified pediatric dentist, and we provide orthodontic care with our orthodontist, Dr. Aaron. So, how long does it take? Well, guys, it depends on you and the complexity of the case. On average, it does take 2 years to have your teeth beautiful and straight. I actually have braces myself, and I'm in year 1, and I probably have 1 more year until I'm done. So, what are criteria? Why it takes longer in some cases, and in some cases it takes just a year? It depends on your age. If we have a young child with a pliable bone who is growing and changes, usually we do phase 1 orthodontics, when we just straighten the front teeth and maybe expand the jaw to make other teeth fit in the future. We call it phase 1. Phase 1 usually does not take more than a year. Usually we expand your upper jaw with a special appliance and then straighten the teeth, and your kid is good to go. When we have phase 2 orthodontics, that means no more baby teeth. You have only grown up teeth. You're at least 12, 13-year-old, and you want to have all the teeth nice and straight forever, for life, hopefully. So that might take longer. It depends on the complexity of the case. If it's just a cosmetic, just moving some teeth around, we might suggest for you to do Invisalign. Invisalign is the clear retainers you wear all the time, and it just straightens overall teeth. Sometimes Invisalign can actually fix complex cases, but it depends on your doctor if he chooses to do Invisalign or traditional braces. This extremely important to be compliant, because believe it or not, we have patients who've been in Invisalign longer than they should. Why? Because you don't wear retainers. If you do not wear retainers, your teeth, guess what? They don't move. They stay where they were, and then you come back and like, oh, the Invisalign doesn't work. It works, believe me, but it does take time and compliance. Also, it depends if you're keeping your appointments or not. Every time you see an orthodontist, they do a little tweak here and there to make your smile beautiful more and more and more. They treat you. And if you skip your appointments, you push your treatment for a longer date. That's how long does it take. So for younger kids, 1 year. For older kids, usually 2 years. Now, your question is, what does it take to do a consultation? How long the consultation is? Well, prepare to be here for at least an hour. Why so long, you would ask? Well, it's a comprehensive consultation and complementary consultation in my practice at Palm Valley Pediatric Dentistry. So what do? We start with a set of x-rays. Cephalometric x-ray provides the special measures of your head and gives us proximity of your profile. Also, we take a front x-ray, which is panoramic, gives us positioning of your teeth, also checking for tumors and cancers at the same time. After that is done, we will take a full set of pictures of your face, your profile, you with a big smile, you with no smile, your nose straight and in profile. A lot of different pictures with your mouth open, with your mouth closed. So we have to have it for records. After this is all done, we're most likely gonna scan your mouth. We have a special iTero scanner, and we will scan your smile. Now, most likely, we're not gonna take impressions. Sometimes we do for certain cases, but now we have scanners. We'll scan your mouth, make sure everything is nice and cool and fits. And then your doctor will go on the computer and plug in all that information. They will plug in all this information to find the best care for you and decide how long would it take, how expensive would it be, because the price varies on complexity of the case. If it's an easy case, it might be couple of $1,000s. If it's a very comprehensive, difficult case, it can be $5,000, $7,000. It depends on the complexity of your case and how long you're gonna see us. Because on my side, we see you every 6 to 8 weeks. We have our team here. We provide the best care we can. So that's what to expect during your comprehensive evaluation. What's new in orthodontics? Well, number one, before we always did phase 1 only in traditional braces. Now the new company Invisalign actually provides phase 1 orthodontics with retainers. But again, if your kid is not compliant, it's not going to work. It will work only on compliant children. But it's a good option. Instead of having metal brackets on your teeth, you might have just a clear retainer. That's something new. Also, we talk about airways. Airway. We never do orthodontics just to improve your airways. There is no evidence to support too. But it's definitely helpful. Because think about it, the roof of your mouth is the floor of your nose. So if it's wider, you probably can breathe better. There's other things involved with your breathing, obviously. But bigger jaw, wider jaw provides actually better breathing, and it's actually improve your sleep as well. So airway-oriented orthodontics is kind of a new trend nowadays when we're trying to improve your airways, make them wider, make you less crowded and restrictive. That's extremely important. So nowadays we screen kids for airway obstruction. If we see very high palate, kind of a long dolichocephalic faces, then we might say, you know what, we can make you a little bit more wider. Maybe you'll start breathing with your nose better, because you should breathe through your nose and eat through your mouth, not opposite, okay? So it's important to use your nose for breathing. What else is new? Well, if we have a young adult, I think it's actually under the age of 35, and that young adult is very restrictive. He has that very narrow palate and crowded mouth, and we can expand. Nowadays, we provide TADs. TADs is the screw which goes with your special retainer, and we're trying to open up the suture, your palatal suture, which is actually fuses at puberty. So now we actually can widen your jaw ergonomically, not tilting your teeth, but actually orthopedically making your bone, your maxilla wider with that appliance. That's something new and started to become more and more popular, especially in people who are struggling with airway problems. So orthodontics is always changing, becoming something new. And you probably heard about Direct Smile company, which went out of business because it was unsupervised orthodontics. So the best way to provide orthodontic care for your child and have orthodontic treatment for you is to see certified orthodontist who actually works with us in Palm Valley Pediatric Dentistry and provide that comprehensive approach care, because there's a big difference between orthodontist and general dentist. Orthodontist has additional 2 to 3 years of residency training. They study only how to move your teeth around. It matters. It's very important to have a good, solid knowledge and predict how your smile and how your jaw are gonna look like in the future, especially for children. When you're 7, how are you gonna look at 20? It all depends how you're breathing, what other components are involved. So it's not just your teeth. It's more about your facial skeletal structure, your smile, your airways. So it's not that simple. And it's never too late. I don't emphasize enough how important it is when, like, look at me, I'm not 20-year-old, I'm much older, and I'm doing braces because something was bothering me and then I wanted to fix it. And finally, when my kids are older, I have more time, I decided to do it. So you moms or dads who've been shy about their smile, it's never too late to fix it. You're not that old. My orthodontist said that his oldest patient was 78 years old, and he actually wanted to fix his smile. Believe it or not, that's true. Share with me, let me know, when did you have your braces? Did you have your braces at all? I can't wait to see you, and thank you so much for watching.